Coming up next on Arizona Horizon, how will the Senate's proposed health care bill affect Arizona hospitals? Also tonight, we'll talk to Superintendent of Public Instruction Diane Douglas about her push to get more money for education. And we'll tour an Arizona museum dedicated to showcasing the West. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Governor Doug Ducey has declared a state of emergency in Yavapai County due to the Goodwin fire, which has grown to 32 square miles and has forced the evacuation of thousands near the communities of Mayer and Dewey Humboldt. The fire is only 1% contained, and firefighters are struggling with high winds and rugged terrain. And day 3 of former Sheriff Joe Arpaio's criminal contempt of court trial included one former employee testifying that he witnessed a tense exchange after a colleague who complained to Arpaio that a command the sheriff had issued would violate a court order barring Arpaio's immigration patrols. Earlier in the day, another former employee testified that nothing changed at the sheriff's office despite that court order. The former supervisor on Arpaio's elite immigrant smuggling squad testified that he didn't even know about a court order regarding the immigration patrols until 17 months after it was issued. Also of note today, the judge declined Arpaio's bid to call U.S. Attorney General Jeff Sessions to testify at the trial. President Trump today weighed in on the Senate's efforts to pass a health care bill, saying that approval will be very tough, but that Republicans will, quote, get it over the line. The Senate has delayed consideration of the measure until after the July 4th holiday, which gives stakeholders across the country time to have their voices heard. We've been hearing from people involved in the health care debate all week. Tonight, a look at the proposed bill's potential impact on our state's hospitals. Joining us now is Jennifer Caracetta, Executive Director of the Health System Alliance of Arizona. Welcome to Arizona Horizon. Good to have you here.
Thank you for having me.
Before we get going, the Health System Alliance of Arizona, what is that?
We are an advocacy organization representing large integrated health systems in Arizona. So my members include Banner, Dignity, Honor Health, and Abrazo and Carondelet.
All right, so how do these providers feel about this plan?
Well, I should start out by saying that we certainly share concerns of many with what we've seen in the marketplace. Increased premiums, lack of consumer choice. So we definitely think there's an opportunity here to make some changes. That being said, we're very concerned about the proposals that are pending right now before the House and the Senate, particularly with regards, if we look at both proposals, we're looking at a significant cost shift to the state of Arizona, and we're talking about the health care of nearly 400,000 Arizonans, and that will have a material impact on our entire state.
And again, what you're talking about is Medicaid and the impact of both of these plans, the Senate's right now, on Medicaid. I mean, it is... Talk to us. 400,000 people under coverage would possibly lose that coverage. The state might be responsible for up to $7 billion through 2026. I mean, that is huge when it comes to providers and the state's economy.
Absolutely. These are individuals who have, we're looking at more than 20,000 cancer patients, individuals with serious mental illness who are in treatment for substance abuse, countless more with diabetes and hypertension. These are individuals who, even if they don't have health care coverage, they're still going to go get health care services. We're going to see them in our emergency departments. So they're still going to be in the system. They're still going to be utilizing services. The question will be, how will we pay for them? And I think we've seen the figures released by our state Medicaid program last week, and it is concerning, because we're going to see the uncompensated care costs in our system, because instead of going into lower cost physicians' offices, we're going to see these folks in our emergency departments. And what I think it's important to understand about uncompensated care is that hospitals can't absorb all the costs associated with those. So we're going to see increased costs and higher premiums. We're also going to see increased impacts on state budgets, because the great impact we see at these changes is going to really present a problem for our policymakers.
The impact on rural hospitals and rural clinics. How much? I've heard that there's a chance that some of these places just simply won't be able to stay open.
I think that there are absolutely serious concerns about what this means for access to care and for patients in rural Arizona. It's also important to understand some of these facilities in rural Arizona are also their largest employers. So this is not only a healthcare issue, it's also an economic issue.
Okay, again, no matching funds as far as Medicaid would be concerned. No matching funds, no inflationary adjustments, no hospital assessment if this goes through. When the Chamber of Commerce says it'll blow a hole in the state budget, they're not kidding. I mean, this is some serious money we're talking about here.
Absolutely, and it's not just a decision that will impact healthcare. Our policymakers will be forced to make decisions about maintaining coverage in our program and also funding other priorities like education, public safety, transportation. It'll present some very difficult decisions.
And yet, Republicans mostly say something needs to be done. You started off by saying that it's obvious something needs to be fixed here, that the current climate is not good, an adjustment of some kind needs to be made. President Trump calls the Affordable Care Act a disaster. Is this plan, the Senate's plan, better than what we have now?
We don't believe that it's the answer. We do believe there's an opportunity to improve the system, but we believe that this proposal goes much further than any attempt to fix the system, and it in fact jeopardizes care for almost 400,000 Arizonans. That's significant. So we believe there's an opportunity for improvement. We just don't believe this is the answer.
But why are so many lawmakers in Washington, people elected to those positions by citizens who wanted to see Obamacare, the ACA, go away? Why are they still, I mean, is this going to increase access for folks, yay or nay?
Based on what I understand, we're facing access to care issues potentially throughout our state.
Okay, is it going to lower costs, yay or nay?
I would have a difficult time seeing where that would happen in this proposal. I think, and I think you've raised a good point. One of the things we've really seen happen over the past few years is real innovation in our healthcare industry. We've been bending the cost curve. We've been improving quality of care. But none of this matters if our patients don't have coverage.
So what would constitute, from your angle, from the folks that you represent, what would constitute a better healthcare plan?
Well, I think our top priority would be protect our Medicaid program. And I think, you know, it's important to understand, too, Arizona has one of the best Medicaid programs in the country. We have lower costs, great quality of care. It is a system that drives innovation into our industry. So let's focus on the marketplace. Let's focus on trying to find ways to make it more affordable for patients and to give consumers more choice.
Tomorrow's show, we're going to talk about what happened in Nevada, what almost happened in Nevada, as far as Medicare for many, if not Medicare for all kind of a system. Are we moving, I mean, I know that the Democrats and those on the left are looking for a single payer system. And folks on the right say, no, that's socialism. They want to see more of an integrated market answer to all this. Where are we going in this debate? It doesn't sound like the Senate or the House, neither one has the answer. And if they do, that's not going to be the answer for long because it'll be tinkered with and messed with. Where are we headed in all this?
You know, it's difficult to say at this point. We certainly share the anticipation of many and seeing what not only comes out of the Senate in this week, but what we see in the next few weeks. Where the answer is in terms of a model and what that looks like, I could only speculate. You know, we have a great public-private partnership in our Access program in Arizona that does leverage the private market, and we see great outcomes based on that. So I do believe that there's real opportunity to do some good here.
But why didn't it work as far as the Affordable Care Act is concerned? Why are there so few options now for Arizonans as far as insurance in the marketplace?
And I think it's important that, you know, we're talking about two different pieces of the Affordable Care Act here. And in Arizona, with drastically different results. We continue to have one of the leading Medicaid programs in the country, and this state led the nation in premium insurances.
Yeah.
So I think we have to look at them separately.
And when you do look at them separately, I think it's human nature. You look at the one that works, and you decide maybe we go in that direction or something along those lines. How serious are hospitals taking this and providers taking this? I mean, it sounds like it'll be gradually moving in that direction as far as the bill is concerned. It's a bit of a run-up, a slow run-up, but it's going to happen. How are they reacting?
We take it very seriously. We have offered our assistance to the entire delegation. We're ready to be of help. These are not easy questions to answer, and so from our perspective, we're here, we're ready to listen, we're ready to provide assistance and feedback.
What are you hearing from the delegation?
They've been listening. We've been able to provide some great information to them, and they've been very receptive to the feedback that we've given them.
So you think they understand the ramifications?
I think they're taking it very seriously as well.
You think the public understands the ramifications?
I do. And when folks know what I do for a living, and I get questions all the time. No difference anymore between personal time and professional time, because everybody is talking about it. And it's a good discussion to have. And people should be engaged, because this has real consequences for people. All
right. Well, good information from you. Thank you so much for joining us. We do appreciate it. And coming up on Arizona Horizon, State Superintendent of Public Instruction Diane Douglas talks about how to keep teachers teaching in Arizona.
Hi, I'm Paula Kirker, President of PBS, and I'd like to personally thank you if you've made a contribution to Arizona PBS. You know, when you fund your favorite shows on this station, you're ensuring great television continues to be available for yourself, your family, and everyone in your community. One of the easiest ways to do that is by making a monthly contribution on an ongoing basis, what we call sustaining membership. When you call, tell us how much you'd like to donate each month. Our current sustainers tell us that $10, $15, or $20 a month is best for them, but you decide what works for you. After you've made that call, we will deduct that amount each month from your credit card or your bank account, and we will continue until you tell us otherwise. Your membership will always remain current, and renewal notices will become a thing of the past. Best of all, your ongoing support means that the best television on television will continue to come your way every single day of the year. So please, consider a sustaining contribution today. Thank you for your support of this PBS station.
Arizona teachers are expected to receive a slight increase in their paychecks when they return to their classrooms after the summer break, but is the 1% increase enough to help with teacher shortages and retention? Among those who want to see teachers get more money is Superintendent of Public Instruction, Diane Douglas, who joins us now. Good to see you again.
Thank you for having me again.
Let's just get right to the education tax and the extension, which has to happen by 2020, the end of 2020, or that tax to 0.6% goes away. You want to see an extension. You want to see an increase on this tax. Talk to us about it.
Well, what has become very apparent, first of all, I've had the privilege I'm on my 4th tour of the state of Arizona since taking office. And clearly what people say to me, doesn't matter where we are, how you want to describe the demographic, they want their teachers paid better. And clearly, you know, we have a over $9 billion budget, but there's not that much new money each year. If we want to compensate our teachers, we need new money. So we're looking at bumping that up to a full cent, a 1/4 of a cent from a 1/6 of a cent, and to make that permanent. I spent 8 years on a school board, Ted, and fiscal cliffs are virtually impossible for school board members to deal with, even when they're 20-year cliffs.
Okay, so you're expanding 0.6 up to a full cent. The funds, as far as you're concerned, close to 11%. You want those funds to go to teachers.
We want it to teachers, and about 3/4 to teachers and 1/4 to school facility board to help with our crumbling infrastructure. You know, there's another lawsuit has been filed against the state, and so we're figuring $100 million, which is probably not enough, but certainly to help address that issue.
Immediate raise there, close to 11%. By year 3, the raise would be 11% or so. Do you think, just in the teachers, we'll get to the capital improvements in a second here, but as far as teacher improvements, is that enough to help with retention?
I certainly hope it sends a strong message to our teachers. Salary isn't the only reason why our teachers leave the profession, but it certainly helps. I mean, would you work if yours was the lowest paying salary in the nation?
No, I think we know the answer to that, Superintendent.
I think we do.
Yes, we do.
So we need to get some money. And we're talking about, you know, $5,000, which may not seem like a lot, but that's groceries for a family of 4.
Yes.
Student loans they have to pay.
I want to get back to teachers in a second, but one more aspect of this would be capital improvements and repairs and such. And again, that needs to happen, and it needs to happen in a big way.
It does. It does. And we're hoping that we can use this to get some of that money into that system. You know, one of the things that was a big surprise to me, my difference between my school board service and now, is to find out that our school facilities are basically a grant process, that We now make decisions whether your roof is leaking worse than my air conditioners are broken. All our children deserve great schools.
All right, why increasing the sales tax, I should say, and not going to another revenue generator?
Well, I certainly invite all discussions to come to the table. Right now, we know we have to deal with Prop 301. It's going to sunset. I can't even imagine what would happen to our system if we lost that. So we know that's a readily available issue to address. The community's familiar with it. They know what it's been doing. One of the things that we'll do differently, and I will recommend actual wording to our legislature for this proposition and the extension of it, is it'll have non-supplanting language so that the money has to go to our classroom teachers and to the school facility boards, because that's one of the problems that I've heard. Well, we've heard this before. Prop 123,
right,
was going to go to our teachers. Well, the language is not there to guarantee it.
Response from the governor on this?
We have reached out. We talk with his staff. We've not had a particular specific response on it yet. It's a little early in the game. And again, we welcome all discussion. If there's better revenue streams out there, I would love to hear about them.
It's a little early in the game, but you got two shots to get this onto a ballot, 2018 and 2020, or else adios goes the tax. I mean, how do you convince fellow lawmakers, especially Republicans, not only to extend the 6/10, but to bump it up to a full cent? It sounds like a tax increase to me.
Well, it is a little tax increase, but we have heard from the community. I've heard from the community, again, in 3 full tours around the state, that's something they support for our teachers. They have one of the most vital jobs in this state. They have, it sounds like a cliche, but they have our future in their hands. And we have to make sure we take care of them.
And yet you have one Representative Mark Finchem, I believe, believes that a 5-year study should be done to find out why teachers are leaving the classroom. That does not sound very urgent to me.
Well, I look forward to speaking with Representative Finchem on those issues, because certainly this is not an issue, in my opinion, that can wait 5 years to be addressed.
So, and I know you've mentioned that you think that teachers feel restricted, disrespected, and underpaid. Explain that. Why do teachers feel that way?
You know, one of the things, as I've traveled the state and talked to our citizens of Arizona, it's almost like from the, if you will, 30,000 foot level, we beat up on education in Arizona. But when I talk to citizens and I talk to teachers, I had a listening tour down in Tucson just a couple of weeks ago. And the teachers came and they talked to me about how wonderful their parents are, and they come in and they're so appreciative of what they do. So there seems to be, in my opinion, almost this big disconnect between what happens on the local level and how we let broad discussions demoralize us.
Representative Finchem again said there was no empirical data that shows that Arizona is losing teachers due to low pay. That's why he wants the study. Is he wrong?
Well, we certainly know we're not filling our teacher positions. You know, we have openings virtually in every single school district that we look at. So they're not in the classroom. And, you know, in many industries, they all have, you know, maybe not, they have more spots to fill than they have employees to fill them. But let's think about it. If you're going to pick your favorite store of your choice and they have some open spots, what does that mean? An extra register isn't open, or you wait a little longer in line? We're talking about our children here having someone qualified in front of them each and every single day. We can't afford to have openings.
Last question on this. We got about 30 seconds or so. How far are you willing to go to the wall on this? I mean, how far do you go on this?
I can't imagine an issue more important than our children's teachers in their classroom. So certainly, I hope that we can convince the legislature that this is a very reasonable and a very moderate step to take, and to be able to ensure that this money will actually go to our teachers, because we'll put the language in the referral.
All right. Superintendent Diane Douglas, good to have you here.
It's always a pleasure to be here. Thank you so much.
Thank you. The Western Spirit Museum in Scottsdale opened 2 years ago and has since picked up national recognition to the point of becoming a Smithsonian affiliate. Producer Maria Portillo and photographer Rob McJanet give us a closer look at the museum.
In the heart of Scottsdale's art district beats the spirit of the Old West. You can see it in the eyes of Native American children, the grizzled wrinkles of old cowboys, and the proud faces of Western women. It's only been open for 2 years, but director Mike Fox explains that this museum has been a vision for much longer.
It's been a dream of this community of Scottsdale for a number of decades, back actually a good 30 years ago.
Those 30 years were spent raising funds and curating the collection, finding those symbols that tell the story of the West.
This is a very unique museum that has objects that are three-dimensional, working cowboy, saddles, spurs, boots, and then you can walk into the room right next to you and see in the gallery those same things, you know, the saddles painted on horses and fine art. So we have quite a diversity of art of the American West.
That art attracts out-of-town visitors and also young Arizona families.
This museum was really established with one goal in mind, and that was to help young boys and girls whom live here, maybe were born here, and possibly will live the rest of their lives in this region, to have themselves a better understanding and appreciation of place of birth, place of education, place of future work.
Its location is a huge part of this community. Arizona artist John Coleman says it's been a long time coming.
Scottsdale has always been sort of a hub of Western art, but when this museum came, it was like the third leg on a table. It finally pulled everything together.
Thanks to collections from artists like Coleman, the museum has gained national recognition. In fact, it's one of the youngest institutions to ever become a Smithsonian affiliate, a title museum director Mike Fox does not take lightly.
Because of this affiliation, we do have always the responsibility to see that this institution is professionally presenting itself to a public in the manner that the Smithsonian would expect of any affiliate.
As an affiliate, the Western Art Museum can rotate art with 19 other Smithsonian institutions and present art collections like the Taos exhibition.
Yeah, the Taos is, I like to think of it as ground zero for Western art. They put together a group that started to create a style and a look, which has influenced artists like crazy. I mean, in recent history especially.
The exhibition tells the story of 19 European artists who traveled to the West and by accident land in the community of Taos, New Mexico, eventually settling there. Curator Tricia Loescher says the artists were inspired by what they saw.
The people, the Hispanic people, the American Indian people, they were quite taken by a very distinct kind of quality, both in terms of culture and landscape and the environment, in order to create what they saw as really a unique American art.
The Taos exhibition is filled with letters, journals, and photographs of the artists who lived in Taos. The vibrant colors and generous paint strokes tell more than what fits the frame.
So we really have an exhibition that's not only great art and masterpieces, but it speaks to relationships and communities and really just being who you want to be and finding yourself in the West.
And ultimately, the goal of a visit here is not just to look at what the West was, but what it still is and what is left to preserve.
For more information on the museum, visit their website at scottsdalemuseumwest.org. Tomorrow on Arizona Horizon, we continue our discussion on the Senate's proposed health care bill with a look at what could be a better idea already in place in Nevada. And we'll speed on over to PIR to check out some new changes to the racetrack. That's tomorrow, right here on Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your PBS station. Thank you.